Low back pain is one of the most common health problems people face worldwide. It can affect anyone, regardless of age or lifestyle, and is often caused by a combination of factors that might include poor posture, muscle imbalances, lack of physical activity, and sometimes even stress or mental health concerns. Whether your back pain is mild and occasional or chronic and debilitating, it's important to understand that there are several effective ways to manage and, in many cases, reduce or completely eliminate the pain. The approach you choose will depend on the severity of your pain, its underlying cause, and your personal lifestyle. In this comprehensive guide, we will explore various methods and strategies that can help you find relief and improve your overall quality of life. One of the first things to recognize when dealing with low back pain is that taking an active role in your recovery can make a significant difference. It's tempting to simply rest and avoid movement when you're experiencing pain, but this can often prolong the issue. In fact, staying sedentary for extended periods of time can lead to weakened muscles, poor posture, and even further pain. Instead, you should aim to incorporate gentle movement into your daily routine. One of the most effective ways to relieve lower back pain is through exercise, but it is essential to choose the right types of exercise to avoid exacerbating the issue. A well-designed exercise regimen that includes strengthening, stretching, and mobility work for the spine and surrounding muscles can alleviate pain and prevent future flare-ups. Core strength plays a crucial role in supporting the spine, and weak abdominal, back, and hip muscles are often a major contributor to low back pain. The muscles of your core act as a support system for your spine, so when these muscles are weak, your back bears more strain. Exercises like planks, bridges, and bird dogs can help strengthen the core and support the lower back. These movements target not only the abdominal muscles, but also the glutes, lower back, and hips, all of which work together to maintain proper posture and prevent discomfort. Flexibility is another key component of back pain relief. Tight muscles around the lower back, hips, and legs can increase tension and contribute to pain. Regular stretching can help improve flexibility, reduce muscle tightness, and prevent strain. For example, stretches like the cat-cow stretch and child's pose are particularly helpful in releasing tension in the lower back. The cat-cow stretch is a simple movement that involves moving your spine in a flexion and extension pattern, which can help increase mobility and alleviate discomfort. On the other hand, child's pose is a resting position that allows the lower back to stretch while also promoting relaxation. It is also important to pay close attention to your posture, as poor posture is often a contributing factor to low back pain. People often don't realize how much their posture can impact their spine. When standing, make sure your weight is evenly distributed on both feet and avoid leaning to one side or locking your knees. Stand tall with your shoulders back and your chin slightly tucked. When sitting, it's important to keep your feet flat on the floor and your knees at a 90-degree angle. Your lower back should be supported by the chair's lumbar support, and you should avoid slouching or leaning forward. For individuals who spend a lot of time sitting at a desk, it's essential to ensure that your workstation is set up correctly. Your computer screen should be at eye level, and your chair should allow for proper support of your lower back. Another strategy for managing lower back pain is using heat and cold therapy. Ice and heat have been used for years as a way to reduce inflammation and relieve muscle tightness. For acute pain, applying an ice pack to the affected area can help reduce swelling and numb the area, providing relief from pain. Ice should be applied for 15 to 20 minutes several times a day during the first 48 hours after the onset of pain. After the initial swelling has decreased, heat therapy can be beneficial. Heat helps relax tight muscles and increase blood flow to the area, which can promote healing and relieve stiffness. A warm bath, heating pad, or warm compress can all be effective forms of heat therapy. If you find this video helpful and informative, please support the Healthy Pantry channel by leaving your comment below, liking this video, and subscribing for more daily health and nutrition tips. For mild to moderate pain, over-the-counter pain relievers like acetaminophen or nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen, can be helpful. These medications work by reducing inflammation and relieving pain, allowing you to move more freely and engage in the exercises or stretches that will ultimately help improve your condition. However, it is important to use these medications sparingly and follow the dosage recommendations. If the pain is persistent or worsens over time, it may be necessary to consult a healthcare provider for further evaluation and treatment. While managing pain with medication and therapy is important, it's also essential to avoid prolonged bed rest. Contrary to what many people believe, staying in bed for long periods of time when you have back pain can actually make the problem worse. It can lead to muscle weakness and stiffness, both of which can contribute to further pain. Instead of resting in bed, try to stay as active as possible, but be mindful of the intensity of your activity. Gentle movements, such as walking or light stretching, can help maintain mobility and prevent stiffness from setting in. It's also a good idea to avoid high-impact activities or movements that could strain your back during the recovery process. In some cases, when back pain is more severe or persistent, physical therapy might be necessary. A physical therapist is trained to evaluate your condition and design a personalized treatment plan to address your specific needs. Physical therapy often includes a combination of exercises designed to improve posture, strengthen muscles, and increase flexibility. It may also involve modalities such as ultrasound or electrical stimulation to help relieve pain and reduce inflammation. Working with a physical therapist can be extremely beneficial in addressing the underlying causes of your pain and in teaching you techniques to prevent future episodes. If you're frequently lifting heavy objects or engaging in activities that require bending or twisting, it's important to adopt proper lifting techniques to avoid putting undue stress on your back. Always bend at your knees rather than at your waist when picking up objects. Keeping the object close to your body while lifting and avoiding twisting motions will help prevent strain on the lower back. You can also try to avoid carrying heavy loads by using a cart or asking for help whenever possible. Sometimes, low back pain can be exacerbated by stress. When you are stressed or anxious, your muscles, especially those in the back and shoulders, can tense up, contributing to the sensation of pain. Finding ways to manage your stress is an important part of managing back pain. Mindfulness, deep breathing exercises, meditation, and even activities like yoga or Tai Chi can be incredibly effective for both reducing stress and promoting physical relaxation. These practices help calm the mind while stretching and strengthening the body. They also allow you to develop a deeper awareness of your body and your posture, which can help prevent back pain in the long term. In addition to stress management, maintaining a healthy weight is important for managing low back pain. Extra weight, especially around the abdominal area, puts additional strain on the lower back. This can lead to discomfort and even long-term issues such as degenerative disc disease. By maintaining a healthy diet and engaging in regular physical activity, you can keep your weight within a healthy range, reducing the pressure on your spine and preventing future pain. If your back pain is chronic or doesn't improve with these measures, it's important to consult a healthcare provider. Sometimes, persistent low back pain may be due to underlying conditions like herniated discs, spinal stenosis, or arthritis. A doctor may order imaging tests such as an X-ray or MRI to get a clear view of the structures of your spine. Based on the findings, they may recommend additional treatments such as injections, medications, or even surgery in more severe cases. There are also alternative treatments for back pain, such as chiropractic care, acupuncture, and massage therapy. Chiropractic care focuses on spinal manipulation and alignment to improve mobility and reduce pain. Many people find relief from chronic back pain with chiropractic adjustments. Acupuncture, which involves inserting thin needles into specific points on the body, is another option that some individuals find helpful for pain management. Massage therapy, particularly deep tissue massage, can help release muscle tension and improve blood circulation, which can promote healing and reduce discomfort in the lower back. To sum up, low back pain is a complex issue with multiple potential causes and contributing factors. There is no one-size-fits-all solution, but by taking a multifaceted approach that includes exercise, stretching, proper posture, heat and cold therapy, stress management, and possibly physical therapy or medical intervention, you can significantly reduce or eliminate the pain. The key to success is consistency and being proactive in addressing the factors that contribute to your discomfort. With time, patience, and the right strategies, you can find lasting relief and return to an active, healthy lifestyle. Thank you for joining us here at the Healthy Pantry. We hope you found the information valuable and inspiring. Remember, your health is a journey, and we are here to guide you every step of the way. Thank you for watching, and we will see you in the next video.